Altered cellular and tissue biology. What is cellular adaptation? It's actually the cell's response to escape and protect itself from injury. Adaptation is reversible, structural, or functional responses to both normal or physiological conditions and to adverse or pathological conditions. Cells are able to adapt to change in their environment in several ways. First, atrophy. Atrophy is the decrease or the overall shrinkage in a cell's size or therefore an organ size. An example of this would be skeletal muscle deprived of innervation. The atrophy of the thymus gland in early human development and withdrawal of growth factors in breast tissue after estrogen levels decline with menopause are also examples of atrophy. Hypertrophy, this is the increase in the size of cells or organs. An example of this would be skeletal or cardiac muscle due to increased workload. It can also be physiologic, like the uterus growing or the mammary glands working during pregnancy. It could also be pathologic, as in the response to cardiac myocytes to sustained hypertension. Hyperplasia is the increase in the number of cells due to increased mitosis. An example of this would be if the liver is partly removed, it will enlarge to compensate. Breast enlarged due to hormonal signals during pregnancy. There are two types of physiologic hyperplasia. Compensatory hyperplasia occurs with growth factors that stimulate cell division in response to a particular tissue loss. Hormonal hyperplasia occurs when hormone-responsive cells are activated, such as the breast, the uterus, the prostate. They all undergo cell division when hormone stimulation increases. You think about during puberty. And lastly, dysplasia. This is the abnormal change in size, the emphasis on abnormal. There's changes in size, shape, and organization of mature cells. Now, this is not a true adaptive change. It's actually due to persistent and severe irritation. Often, it can be reversible if you remove the stimulus. An example of this would be cervical dysplasia due to the human papillomavirus. When pathologic hyperplasia is complicated by cells of abnormal size, shape, and organization, we refer to this as atypical hyperplasia or dysplasia. Metaplasia is a reversible replacement of one mature cell for another type of cell. Sometimes it could be a cell that's less differentiated, and this can be reversible or it can progress to dysplasia and neoplasia, which is cancer. An example of this would be the bronchi pseudostratified ciliated columnar cells. They can turn into stratified squamous epithelial cells. This metaplastic change can occur in the distal esophagus as a result of having chronic reflux of acid from the stomach, such as in gastroesophageal reflux disease, or what we call GERD. The normal squamous epithelium is replaced then with columnar or granular epithelium cells that are usually found in the stomach. Here you can see an example of hypertrophy of the left ventricle. You can see the cellular adaptation has occurred because the left ventricle of the heart is the major pump against a higher pressure system, higher than normal. So the muscle then is subjected to doing more work because, again, our heart is a muscle. And when we have a release of growth factors such as angiotensin II being released, this can also cause hypertrophy of the left ventricle. So in response to the growth factors, the cardiac myocytes that synthesize more proteins, and intercellular organisms and organelles, it's going to increase in size. This then is going to affect all the cells within the ventricles. And because of this, you can see the increase in the wall thickness as shown in the schematic. We have to distinguish between normal physiologic versus pathogenic adaptation. Pathologic hyperplasia refers to abnormal increase in cell division resulting from tissue injury or excessive hormonal stimulation. It can be a precursor to metaplasia, dysplasia, or even neoplasia, again meaning cancer. In many cases, pathologic hyperplasia is going to be concentrated in clumps of dividing cells that form nodules in the affected organism. And so the anatomic changes that you can see in such as benign prostatic hyperplasia or BPH can occur, where the hyperplasia of the epithelial and stromal cells lead to the formation of grossly visible nodules. You can see here, normal physiologic, pregnancy increases the uterus, pathogenic, cardiac hypertrophy. Giving you another chance to think through the examples of the different types of adaptation. When you think of dysplasia, you can think cancer. Hyperplasia, again BPH. Metaplasia, an example would be GERD. Physiologic changes, uterine growth during pregnancy. And pathogenic changes would be cardiac hypertrophy. So let's practice. When does cellular injury actually occur? Excessive hormonal stimulation causes cells in the ducts of the breast to change their shape, size, and arrangement. This is actually dysplasia. During childhood, the thymus decreases in size. This is atrophy. And during puberty, the male and female reproductive organs grow and develop into mature forms. If you chose hyperplasia, you're correct. Now we're going to look at cellular injury. And cellular injury occurs if the cell is unable to maintain homeostasis. So what is homeostasis? This is the normal or adaptable state in response to stress or other injurious stimuli that can occur in our body. Now our cells strive to maintain stability and function despite having challenges. There are two types of cellular injury that we're going to talk about. There's the reversible, where cells can recover if the stimuli stops, and there's the irreversible. Cells will actually die due to severe or prolonged damage. Some examples of this would be, think about mild hypoxia, temporary toxin exposure. Those things can be reversible. However, if you have severe hypoxia or extensive cell damage, those things would not be reversible. So therefore, they're irreversible. What then is the most common cause of cellular injury? If you chose hypoxic injury, you're correct. The most common cause of cellular injury is actually hypoxia. And this is the lack of sufficient oxygen supply to our cells. Hypoxia can actually occur due to various reasons, such as having decreased blood flow, which is also called ischemia. Hypoxia can occur if a patient has respiratory problems or a reduced oxygen carrying capacity of the blood, also known as anemia. There's other common causes of cellular injury that include physical agents like trauma, being extreme temperatures, or chemical agents like toxins or drugs, infectious agents like bacteria and viruses, and immune reactions. These factors can disrupt our normal cellular functions and then lead to injury. This schematic is showing you the pathway of when it can become reversible or irreversible. So reversible, we can get back to a normal cell state, and irreversible will eventually lead to cell death. So we're going to talk a little bit more about hypoxic injury then. It is the single most common cause of cellular injury, and it occurs when our cells are deprived of an adequate amount of oxygen. And there's several reasons that this can occur. If we have reduced oxygen in the air, think about being in an environment where there's lower oxygen levels, like being in high altitudes, like in the mountains, or there's a loss of hemoglobin or decreased hemoglobin function. Remembering hemoglobin is responsible for carrying our oxygen in the blood, and if we don't have enough functional hemoglobin, then our cells won't receive sufficient oxygen. Hypoxic injury can also be from decreased production of red blood cells. Our red blood cells carry our oxygen to the cells, and there are conditions that could decrease this production, like certain anemias. They can lead to hypoxic injuries if not corrected. Respiratory and cardiovascular disease can also cause hypoxic injury. If we have disease that affect our lung and our heart, it can reduce the oxygen delivery to our overall cells. And lastly, poisoning of oxidative enzymes. So substances that interfere with enzymes responsible for oxygen utilization within cells can actually lead to hypoxic injury as well. So let's define ischemia. Ischemia is an inadequate blood supply to an organ or a part of our body, especially our heart muscles. It's the most common cause of hypoxia. When we think of ischemia, think of reduced blood supply. If gradual, then adaptation can occur. But if it's excessive, then more damage can happen through our body. An example of ischemia would be if you have a growing thrombus or clot which gradually blocks a blood vessel. This can result into ischemia, which is a type of hypoxic injury. We also have what's known as ischemia reperfusion injury, and this causes additional harm to our body's cell. There are mechanisms underlying this ischemia reperfusion injury. They include oxidative stress, which is the sudden influx of oxygen during reperfusion, and this can actually generate reactive oxygen species, or what some people like to call free radicals. This can cause damage to our cells, like our lipids, or the cell structures like lipids, proteins, and even our DNA. Ischemia reperfusion injury can also be influenced by increased intracellular calcium. Ischemia can disrupt the balance of our calcium ions within the cell. Reperfusion leads to a rapid influx of calcium, which can trigger harmful enzymatic reactions in cell death pathways. And so, again, it's not the calcium itself, but it's because there's such a rapid influx during reperfusion. Reperfusion can also activate immune cells and promote inflammatory responses. We call this inflammation. Inflammation can contribute to tissue damage as well. And lastly, the complement activation this complement system, which we're going to learn more about this semester, is part of the immune response, and it can be activated during reperfusion and contribute to tissue injury. When we use the term anoxia, whenever there's an A in front of a word in healthcare, usually it means the lack of. And in this word, anoxia, it means the total lack of oxygen. This is not well tolerated in most of our body's tissue. Our body likes oxygen. Think about an embolus which lodges into a vessel. It can turn into or cause an anoxic state. Cellular responses can also cause hypoxic injury. When we have a decrease in ATP, this is going to actually cause a failure of our sodium-potassium pump. And with that, the sodium-calcium exchange that occurs. Then sodium and calcium are going to accumulate inside the cells, pushing potassium outside the cell. Can cause cellular swelling because there's a movement of sodium inside the cells. This can be reversible if our oxygenation is restored and our sodium-potassium pump and sodium-calcium exchange systems work again. But this would require an increase in ATP, which requires an increase in oxygen. And lastly, vacuolation. If our oxygenation is not restored, vacuoles will then accumulate in the cytoplasm and the organelles will actually swell. Now we're going to talk about hydropic degeneration. And hydropic degeneration refers to the accumulation of having excessive water within malfunctioning cells. The condition itself is typically reversible if we can remove the underlying cause and address that before cells undergo irreversible damage. So you have to get to it before. Hydropic degeneration is frequently observed in cells taken from regions affected by edema, which is swelling or the normal buildup of fluid in our tissues. The key takeaways of hydropic degeneration are that cells can accumulate too much water due to dysfunction. They can be reversed if the cause is corrected before the permanent damage happens, and often they're found in areas with edema where fluid accumulates in the tissue. Now, looking from a hypoxic standpoint, if you have an injury causing hypoxia, this will then reduce ATP production. Our sodium and water will then move into the cell, pushing potassium out. When we do this, we will increase osmotic pressure, meaning more water is permeable into the cell, and therefore our organelles swell up and they can actually rupture and form vacuoles. When you have extensive vacuolation, which is this process, we end up with hydropic degeneration. When does cellular injury become irreversible? When the damage to the cell is so severe that the cell's essential functions and structures are irreparably compromised, leading to overall cell death. And this typically occurs when the injury surpasses the cell's ability to repair and restore itself. So some factors that can contribute to this is mitochondrial damage, membrane permeability. If we have a loss of enzymatic function, genetic damage, maybe there's severe oxidative stress, an overaccumulation of toxic metabolites, loss of structural integrity, or overwhelming inflammation. Overall, a lack of ATP production due to mitochondrial damage can be a major reason why we cannot reverse a cellular reverse cellular injury from occurring. Reperfusion injury due to oxidative stress is another reason. Again, when oxygenation is restored, reactive oxygen intermediates can damage the organelles. So free radicals will damage these organelles. Sometimes this can be prevented if we use antioxidants. So what then is oxidative stress? What is a free radical? Free radicals can cause damage in parts of cells such as proteins, DNA, and even cell membranes because they steal the electrons through a process called oxidation. This is why free radical damage is also called oxidative damage. These free radicals and reactive oxygen species, they are electrically uncharged atoms, or they're electrically uncharged groups of atoms that are unpaired and are damaged. Lipid peroxidation is when you have damage to the membranes of the cell and the organelles. And when we have lipid peroxidation, this is going to increase permeability when we don't want it. We also have alterations of proteins, especially those for the ion pumps and transport proteins. Our DNA can be altered. Fragmenting of DNA reduces protein synthesis. And mitochondrial damage, which allows more liberal calcium and cytosol. In terms of chemical injury, we have this term called xenobiotics. Xeno meaning foreign, foreign to life. The liver is an initial site of contact for many of ingested xenobiotics, metabolizes many over-the-counter drugs, prescription drugs, and alcohol, making it very susceptible to chemical-induced injury. Carbon tetrachloride is a xenobiotic. The liver converts this to toxic free radical, which then causes lipid peroxidation. Remember, we don't want that because it damages the membrane and it releases lysozymes, leading to mitochondrial damage. This can actually cause fatty liver, cellular autodigestion, and a decrease in our overall ATP production. Lead is also a xenobiotic. It causes neurologic problems. It can actually interfere with our neurotransmitters being released. Lead can cause anemia and other renal problems as well. Carbon monoxide prevents oxygen from binding to our hemoglobin, causing, therefore, hypoxic injury. Ethanol, acetaldehydes and free radicals in our liver can actually cause inflammation, fatty liver, changes to the overall membrane. It decreases CNS by acting on the reticular formation, which inhibits our unacceptable behaviors. Ethanol meaning alcohol. And mercury. This causes birth defects and brain damage in fetuses and in small children. And then, of course, we have our social and our street drugs, which you can see a more in-depth look in your textbook. Chemical agents, including drugs, I just want to spend a little bit more time here expanding. Now, when we talk about drugs in healthcare, we're not just talking about prescribed or over-the-counter things. We also want to think about supplements and other treatments that patients may find to use. However, over-the-counter drugs and even prescribed drugs, being chemical agents, they are the leading cause of child poisoning. They can directly damage our cells by combining with critical molecular substances. Chemotherapeutic drugs can cause direct damage to our cells, and when we're using any type of drugs, whether over the counter or prescribed. Hypersensitivity reactions can also occur when we have a cellular injury in terms of chemical agents. Think of skin rashes or even immune-mediated organ failure due to the reaction of the drug or over-the-counter drug. Now let's think about now unintentional versus intentional injuries. They can be blunt force injuries that result from mechanical force to the body. Think about things that include tearing and shearing or crushing a tissue. They can also be motor vehicle accidents or falls, contusions, lacerations, and even fractures. Sharp force injuries are things like incised wounds, a stab, a puncture, or a chopping wound. And then we also have gunshot wounds, which is its own category. Asphyxial injuries are caused by a failure of cells to receive or use oxygenation. So asphyxial injuries would include suffocation, strangulation, chemical asphyxiants like cyanide or hydrogen sulfide, and drowning would all fall under the category of asphyxial injury, remembering that it's caused by a failure of cells to receive or use oxygen. Now, infectious injuries actually has to do with the pathogenicity of the microorganism. So not all microorganisms would cause an infection. Disease-producing potential, which is another way to say pathogenicity, refers to the ability of a microorganism to cause disease in the host. So some microorganisms are very highly pathogenic and they have a strong disease-producing potential or pathogenicity, and others have a lower pathogenicity and cause milder illnesses. Pathogenic microorganisms often invade the host tissue and cells, leading to destruction. And this invasion can result in various structural and functional abnormalities within the affected tissue. Many pathogenic microorganisms produce toxins, which are harmful substances that can damage hosts and tissues. And these toxins can interfere with cellular processes like disrupting the membrane integrity or provoking an immune response. And lastly, the production of hypersensitivity reactions. Some microorganisms can trigger these hypersensitivity reactions in the host immune system. And the reactions can result in excessive and harmful immune responses that can contribute to tissue damage and inflammation in the body. In terms of immunologic and inflammatory injury, it's important to note the role of phagocytes. And phagocytes are cells that protect the body by ingesting the harmful foreign particles, bacteria, dead or even dying cells. We also have immune and inflammatory substances like histamine, antibodies, lipokines, complement systems, and proteases that will also help protect us from immune and inflammatory injuries. And then there's membrane alterations that can also occur that either can protect or further produce immune and inflammatory injuries. But which of the following is the most common cause of cellular injury? This is just a review to see if you've captured the last 30 minutes. And the answer here is hypoxia. It's caused by decrease in oxygen in the environment, decreased hemoglobin, red blood cells, or a cardiovascular collapse. These are the most common causes of cellular injury. Now, chemical injuries, free radical injuries, and chemical injuries from pollutants are also types of cell injuries, but they are not the most common. Hypoxia is the answer. Let's think about now cellular accumulations or infiltrations. We have water, lipids and carbs, glycogen, and proteins. Water causes hydropic degeneration, as we mentioned earlier, and it involves the accumulation of excess water in the cells, leading to cellular swelling and dysfunction. With lipids and carbs, in certain conditions, they can accumulate abnormally with abnormal amounts of fats and sugars, so lipids and carbs. They can actually cause fatty liver disease, or if we have too much carb accumulation, it can occur in glycogen storage disorders. And glycogen is it's a stored form of glucose. An excessive accumulation of glycogen can occur in metabolic disorders. For instance, glycogen storage diseases can lead to abnormal glycogen buildup in various tissues. And then protein accumulation can occur due to various reasons. Defects in protein folding and degradation pathways of protein. This can lead to the formation of protein aggregates, which may contribute to diseases like neurodegenerative diseases. Other cellular accumulations or infiltrations include pigments, like melanin, hemoproteins, and bilirubin. Melanin is the pigment responsible for the color of our skin, hair, and eyes. Its accumulation can occur in certain conditions like melanoma or even Addison's disease. Hemoproteins are hemoglobin and myoglobin that contain iron. Their accumulation can lead to conditions like hemosiderosis. And bilirubin is a yellow pigment produced during the breakdown of hemoglobin. And this accumulation can result in conditions such as jaundice. We also have calcium, dystrophic, and metastatic calcification can occur. Dystrophic calcification occurs when calcium deposits damage when they're in damaged or dying tissues, think of atherosclerotic plaques. Metastatic calcification can happen in otherwise normal tissues due to hypercalcemia, often from underlying disorders that have to do with your endocrine function or your parathyroid. And lastly, urate. Urate accumulation can occur when we have too much urate in our body, and this can lead to conditions like gout. So uric acid crystals are accumulating and they're not being excreted properly, and so they accumulate in the joints and tissues, and this causes inflammation and pain. You can see other systemic manifestations listed in your textbook. I want to talk about bruising really quickly, also known as a contusion. Most of us know what bruising is, but we're going to talk about what actually happens and what causes this discoloration. It's often a visible sign of damage to blood vessels and surrounding tissues. And it occurs when there's rupture of small blood vessels that lead to leakage of blood in that surrounding tissue only. What happens is we have first the blood vessel rupture. So whatever the trauma or the injury was, the small blood vessels are going to rupture, such as your capillaries or your venules are going to break. And this can result from, say, a blunt force impact, increased pressure, or mechanical injury. Well, this blood is going to leak out into the damaged vessels and into the interstitial spaces of the surrounding tissue. And this leads to the characteristic discoloration seen in bruises, ranging from red to bluish black. We also will have an inflammatory response when this happens, because the presence of blood outside the vessels will trigger this inflammatory response. Immune cells are attracted then to the site because it's trying to clear away that damaged cell and help with the healing process. Phagocytosis, macrophages and other immune cells actually arrive to this bruised area. They engulf and digest that leaked blood and all the components, and they break down all the trapped blood and clear the tissue of any debris. The color change happens as the bruises heal. The body breaks down the components of the leaked blood, and this breakdown product changes the color over time, which is why our bruises often transition from red to purplish, to green, to yellow, to brown, until the injury heals. This a component that causes the color and bruising is hemosiderin, and we also have iron-free pigments that cause the color changes. Cellular death can occur from necrosis. Necrosis is the sum of cellular changes, often local cell death, and any process of cellular autodigestion. We also call this autolysis. And there are different types of necrosis, and we're going to learn 6 types: coagulative, liquefactive, caseous, fat, gangrenous, and gas gangrene types of necrosis. First, we're going to talk about coagulative necrosis. An example of this would be the kidneys, the heart, adrenal glands, and even protein denaturation. Coagulative necrosis is a type of accidental cell death, and it's typically caused from either ischemia or infarction. In coagulative necrosis, the overall architecture of the dead tissue is preserved for at least a couple of days. This coagulative necrosis is caused by a lack of blood flow, which can occur in any cell of the body. However, most often, again, it's the heart, the kidney, and the spleen. When your cells undergo coagulative necrosis, they usually become very dry, hard, and white. And you can see that here in the tissue, the whitened areas of this example. In liquefactive necrosis, this is a type of necrosis which results in the transformation of tissue into liquid viscous mass. Often it's associated with focal bacterial or fungal infections, and it can also manifest as one of the symptoms of an internal chemical burn. It's characterized by partial or complete dissolution of the dead tissue, and it transforms into this liquid viscous mass. The loss of tissue and cellular profile will happen actually within hours of liquefactive necrosis occurring. So here is an example in the neurons in the glial cells of the brain, and bacterial infection causes examples would be like a staphylococcal or a streptococci or an E. coli type infection. These can all lead to liquefactive necrosis. So think liquid, think viscous mass. Caseous necrosis, the most common example of caseous necrosis would be tuberculosis or TB, also called tuberculosis pulmonary infection. And caseous necrosis is a combination of both coagulative and liquefactive necrosis. So that's why you can see like the white areas that you note with coagulative types of necrosis, and then we have the mushy, viscous, liquidy areas that are common with liquefactive necrosis. So caseous necrosis, think TB. So what type of necrosis would most likely occur in each of the following situations? If we have damage to a tissue that's rich in hydraulic enzymes, what type of necrosis would that be? If you answered liquefactive necrosis, you're correct. If you have damage to tissue rich in lipid digestive enzymes, what type of necrosis would that be? Your key here is lipid. If you picked fat necrosis, you're correct. And lastly, it only leaves coagulative necrosis, tissue destruction by chemicals that denature proteins. Coagulative necrosis. Now, apoptosis is essential for removing redundant and senescent, another way of saying older dying cells, from the body. The death of cells that occurs as a normal and controlled part of the organism's growth and development. That is what apoptosis is. This can occur during embryogenesis. It can also occur when we have elimination of possibly harmful lymphocytes after we have an inflammatory reaction. Apoptosis is needed in our body, so programmed cellular death. Now think about physiologic versus pathologic. Physiologic, things that need to happen, and we know that it's going to happen. It's part of our overall body system and our biology. But pathologic cell death by apoptosis can occur due to pathologic conditions like severe cellular injury. Think of a situation where the injury is going to exceed the repair mechanisms and the resources. It can also occur when there's an accumulation of proteins or genetic mutations that are not correct or they're damaged by free radicals. It can be caused by infection or obstruction of tissue ducts and organs that lead to pathologic atrophy. And this is also going to result in apoptosis. Autophagy is the normal physiological process in the body that deals with the destruction of cells in the body. And it maintains homeostasis of our normally function cells by protein degradation and turnover of the destroyed cell organisms so that we can have new cell formation. During cellular stress, the process of autophagy is upscaled and increased. However, dysfunction of autophagy allows harmful agents to accumulate in our cells, and this process is implicated in several types of diseases. Think of dementia, Parkinson's disease, Huntington disease, heart failure, and cancer are examples where there's a dysfunction of autophagy. It can also be a component of the aging process itself. Let's check our learning. Which type of necrosis best describes cellular death from hypoxia that results in ischemia in the lower extremities? Is it fat, coagulative, liquefactive, or gangrenous? This is actually a topic we have not yet talked about. The answer here is gangrenous. Gangrenous necrosis typically occurs in the lower extremities when our blood vessels are blocked and then ischemia occurs. This hypoxia can then ensue, and then bacteria will invade, causing gangrenous necrosis. Let's think about aging versus disease versus lifespan. Now, aging refers to the progressive decline in physiological functions over time. It leads to increased vulnerability and decreased adaptive capacity. Disease, however, involves pathologic changes that disrupt our normal cellular and tissue function, and often it will accelerate the aging process. In terms of lifespan, this refers to the maximum potential duration of life for an individual, which, when we're thinking about life expectancy as being the average age that a person is expected to live to. The normal lifespan is determined by genetic factors, environmental influences, and it can be increased due to advancements in healthcare, nutrition, and living conditions, but it can also be decreased due to degenerative extracellular changes that can happen. With aging, extracellular environmental changes can cause degenerative changes to contribute to overall tissue dysfunction. Accumulation of advanced glycation end products can cross-link our proteins, affecting our tissue elasticity and our overall function. Extracellular matrices, such as collagen and elastin, they also become less flexible and more rigid, and this leads to our decreased tissue resilience. So this is why we might have wrinkles or more dry skin, more sagging skin. Loss of elasticity is due to the elastin fibers in our skin, our blood vessels, and other tissues. They're all going to lose elasticity over time. This results in reduced elasticity, arterial stiffness, and also it can also decrease our lung compliance when we're thinking of, elasticity. Cellular aging involves the accumulation of damage to our cellular components over time. You think about in terms of atrophy, decreased function, and loss of cells. This can happen due to accumulation of oxidative stress, DNA mutation, and impaired mechanisms that impact our cells' ability to function. Tissue and systemic aging, you think about changes in the structure and function of organs and tissues. Again, collagen and elastin would fall under this. Another example would be sarcopenia, which is a loss of muscle tissue, which is the natural part of aging. And then we have frailty. Frailty is a state of increased vulnerability. It decreases our physiologic reserve as we become older, and it can contribute to decreased mobility, balance, muscle strength, motor activity, cognition, nutrition, endurance, increases more falls, more fractures, and can decrease our bone density. The impact of frailty really increases the risk of hospitalization, morbidity, mortality, and decreases our quality of life. So then, what are some lifestyle changes that might slow down the effects of aging? If we can avoid exposure to substances that will damage our DNA, like ionizing radiation, carcinogens, think of tobacco, overcooked meats, etc. If we eat foods or take supplements that contain antioxidants, this can also decrease oxidative damage to cells, and ones that support the immune system, like omega-3 fatty acids, which is a good example of a supplement that could help slow down the effects. Eating a low-fat diet to avoid atherosclerosis, aerobic exercise because we're trying to improve our cardiac function. If we perform weight-bearing exercises, this will help maintain muscle mass and strength. And then stretching exercises actually prevent the cross-linking of collagen, and it helps to maintain our flexibility. So then, which statement is true with regard to cellular change due to aging? The cell changes are reversible. DNA becomes less susceptible to injurious stimuli. The cellular changes proceed slowly in small increments. Lipid, calcium, and plasma proteins are less likely to be deposited in vessel walls. If you answered C, you are correct. The cellular changes proceed slowly and in small increments. Aging itself is defined as the time-dependent loss of structure and function that proceeds very slowly and in small increments, appearing to be the result of accumulations of small, imperceptible injuries, gradual loss of wear and tear, so to speak. We're going to finish off our conversation today talking about somatic death, or death of the entire person. And we summarize this process into 4 post-mortem changes. The first one being algor mortis, also known as cooling of the body. When algor mortis occurs, the body's temperature drops to match the overall environment's temperature. This temperature drop in the body is about 1 to 1.5 degrees Fahrenheit every hour. With livor mortis, this is when we're going to see the discoloration of skin. Livor mortis, or postpartum lividity, also called, it involves the setting of blood in the dependent parts of our body. So this is why we'll see purplish discoloration of the skin. It also helps forensic experts to estimate the position of the body after death. Rigor mortis is muscle stiffening. So rigor mortis is when muscles start to stiffen after somatic death, and it's due to the depletion of ATP and the accumulation of calcium. It starts in first our smaller muscles, and then it progresses throughout her body. And then it gradually resolves because the muscles will start to break down. So first there's a stiffening and then a resolution of that. And then postmortem autolysis or autolysis is tissue breakdown. It's the self-digestion of our cells by enzymes released only after death. The organelles will start to break down. It releases the contents in the surrounding tissues. Bacteria proliferate, and then therefore it's going to accelerate the tissue breakdown even more. It releases gases and causes bloating. And this is why with postmortem autolysis or autolysis, you will see a bloating of the individual. A coroner examines a body at the scene of a murder and takes note of the following. The core body temperature is 95 degrees Fahrenheit. The surface of the body resting on the ground is purplish, and there's no abnormal stiffening of the muscles. So roughly, how long did this death occur? And which mortise can you use to help think about this? This death probably occurred less than 6 hours, but at least 2 hours, because you think about now the body temperature being 95 degrees Fahrenheit. That body temp drops 1 to 1.5 degrees Fahrenheit per hour. And you also can note liver mortis because the area that where the body is resting on the ground is purplish. So remember that purplish discoloration is moving towards the dependent part of the body.